In Canada, suicide is the 9th leading cause of death. Up to 135 people are impacted by any one death by suicide. Indigenous peoples are disproportionately affected by suicide, which is an outcome of colonization and colonialism. It's crucial to understand that Indigenous identity itself is not inherently a risk factor. Rather, the impacts of colonialism, including systemic racism, are the drivers of this inequity. Cultural practices, land-based healing, and connection to culturally resonant supports all contribute to wellness and are protective. As healthcare professionals confronting this daily reality, we may sometimes feel overwhelmed, yet we all have the power to change someone's life. In providing culturally safe suicide care, we uphold Indigenous peoples' rights to optimal health and ways of knowing and being. It's not about adding to heavy workloads, but enhancing our approach. By embracing cultural humility, we honor Indigenous wisdom, build trust, and create relationships and a healthcare system that serves all communities. Delivering culturally safe suicide care is both a collective and individual responsibility, starting with risk screening. Most standardized screening tools do not reflect Indigenous perspectives on mental health and wellness. It's essential that our practices acknowledge and incorporate distinctions-based holistic views of well-being, grounded in family, community, language, and traditional knowledge. In this video, you'll learn practical strategies for conducting culturally safe suicide risk screening, adaptable to various contexts. Even in urgent situations, we can build trust through trauma-informed approaches that convey respect, understanding, and hope. By being present and attentive, we lay the groundwork for culturally safe care. Collaborate with the person accessing care, their chosen supports, including elders and traditional healers, and relevant health services. Culture is medicine. Engage Indigenous-specific resources when needed or requested to include cultural practices as part of care. Ask for consent before screening. A simple question like, "May I ask you some questions we ask everyone?" shows respect for the individual's autonomy and agency. Indigenous-specific approaches often use life promotion language. Life promotion is grounded in Indigenous knowledge and is about leading with the language of life rather than risk and deficit. This approach lessens stigma and maintains the dignity of those experiencing thoughts of suicide while preserving the validity of screening tools. For example, ask, "Have you wished you were not alive?" instead of, "Have you wished you were dead?" Use, "Have you had thoughts about taking your own life?" rather than thoughts of killing yourself. With practice, humility, and ongoing learning, we can all help reduce health inequities experienced by Indigenous peoples. Culturally safe suicide care is life-saving care. You have the power to change someone's life.